test it, dry needle and test it again and find like a measurable improvement, that's for me, that's a strong indicator that it's that an intervention that I'm going to lean on a bit for that person. And that also a lot with their buy-in as well. When they can see that it's something measurable, like you can show them like a range of motion improvement, or measure like a forward bend, measure kind of their finger to floor measure, something easily quantifiable for them. Strength testing as well, like I'll use a little like digital ergometer that I have, and you can test a lot of different muscles with that. So if you can test, needle, retest, and again show an improvement there, within treatment is fantastic. And then of course you also want to see improvements between treatments as well. So often, like I'll recommend to a person, if I think it's indicated for them, that I want to try like 3 or 4 treatments with the IMS. And I'll let them know that there should be like a noticeable improvement over that period of time. And if it's not going as well as I expected it would, then kind of change course from there.
Okay, yeah. I think I would agree completely. I do similar things, I guess. Like any given day, I think I'm doing it like 10 to 15% of the time with patients. So if I'm treating somebody for several weeks, like they'll likely get dry needling techniques done in the first couple of weeks and try to taper off those things. Kind of like you said, doing the patient response-based feedback, the term that I know Jeff Bostick for us was the one who I don't know if he came up with that term, but I know he used it a lot. And again, like you said, doing the needling technique and then reassessing the same day if there are improvements. So I think that's a good point that you made. And I think sometimes we can get carried away of what dry needling is. In my opinion, like we always discuss, is you have physiotherapy as the main tenets for us is the direct one-on-one contact. So you have the education, you have the self-management techniques, and the exercise. So I think that's the core of physio, and everything else could be adjunctive treatments like acupuncture, dry needling, like shockwave, ultrasound, all that kind of stuff. I would say are adjunctive. So the main physio, the formal physio is anything you do directly with education. It doesn't have to be hands-on, so to speak. So I think some people call in, or in the past, I've worked with patients who are like, hey, I need physio, I need dry needling. I'm like, well, I always try to re-educate and say, no, those are not two different things, but physio can encompass dry needling, but physio itself is not dry needling, right? So I like to educate people on what it is, and that way they're more inclined to do the rest of the program. So if you just get dry needled, for example, then you might not get the benefits that you want. You have to do other things like exercise and other management techniques. So yeah, that's kind of my little spiel on a little bit about dry needling before we get into it. And I know it is different from acupuncture. Acupuncture is more of a traditional Eastern approach based on energy flow and things like that, versus dry needling is a little bit more scientific in the fact that it's been measured with ultrasound studies and things like that. Like it's going after myofascial trigger points versus meridians and things like that. Anything to add on that, Rob?
No, I think like you said it's worth saying again. I think like education, exercise, advice on load management, I think those are like by far the most valuable things that we have to offer. And then everything else is in support of that.
Yeah. That's the thing. That's the best way to do it. I like simplistic explanations, maybe because I have a very simple, basic brain. But I think it's important to know like why you're getting something done, right? Just like how athletes come up to me in the past and say, I need to get taped. And I often ask them like, well, why do you want the tape? I'm like, oh, to prevent injury. I'm like, well, that's not really the exact reason why you need to get taped or things like that. So I think it's good to have a good understanding of it and then kind of go from there. So that way there's no confusion. What I can do is I can open up this presentation, Rob, and to the world. And we can talk about the needling technique itself, and then you can always add any notes that you want. I did a quick I just did it today, so it's not, sorry for any like spelling or grammatical errors to everyone. But it explains what I think is important, what we were taught during the course, and also some research as well, showing some of the benefits with it. So we like research, so peer-reviewed research, relevant, new, systematic reviews, meta-analysis, you know, the good stuff. Rob's got 2 thumbs up for the Instagram people, and he can hardly contain himself. So, so I'm gonna do this screen sharing here with, hopefully I can load it up. Everyone can see that. Well, that's good, I guess. Maybe I can start the view. Is it full screen now, Rob? Yeah, okay. So I'm gonna flip this over on the Instagram, the gram, I guess. So we have a very nice slideshow here. Pursuit of motion physiotherapy, I spelled that correctly, dry needling and IMS. So I'm just gonna sit in the back here to block out some shadows. So next slide. So what is it? So what we're targeting with dry needling is myofascial trigger points. So these are hyperirritable spots in the skeletal muscle that are associated with hypersensitive palpable nodules in a taut band. So palpable meaning you can feel the tight bands, call them muscle knots if you want, and they're quite painful. So usually the symptoms are referred pain or local pain. Referred pain being kind of away from the area, and local being right in that spot. And then during manual stimulation, the patient will experience local pain around the trigger point, meaning if we're poking and prodding, we can actually recreate the symptoms. Yeah, so the bottom 2 things, don't worry about. That's from a previous thing. So I'm gonna accept some more people here into the group here. Good, we got another one on. Oops, let's go back. So advantages of collaboration. Don't worry about that. Anything to add there, Rob?
No, that looks good.
Okay, so next one, next slide here. Fun images. So we have a trigger point complex, right? So you have on the left here, you have a top band, active focus of a trigger point. So that's where you get that muscle knot, where you get a lot of that central pain. Or contraction knot right down here. So those nodules, those spots where we can feel as physios. And then to the right, same kind of thing. You have top muscle, trigger point, and contraction knots in a slightly different image. Yeah, I mean, that's a simple way to look at it. We're not going to talk about myofibrils and like the calcium and all that kind of stuff, because we study too much of that kind of stuff. So anything to say on that, Rob?
No, good images.
Good images. So what happens with the needle? So we call this dry needling, dry being there's no active medical ingredient. So there's nothing we're injecting, right? So that's why we call it dry needling. So there's a local twitch response, LTR, meaning you can actually see the muscle twitch when you put the needle in. That's the trigger point releasing, you could say, which we've heard before. So it can be observed with the naked eye and measured with EMG and diagnostic ultrasound. So they've done studies in this showing improvements afterwards. And we as physios can feel and see the trigger. So we can see that twitch. So what's happening with that is reduction in chemical mediators reported to be active trigger points occur after the local twitch response occurs. This often causes discomfort. Getting needled isn't the most fun process. I wouldn't say it's like truly painful. I just say it's uncomfortable, but it's short-lived. So you can be sore for 24, that's supposed to be to 48 hours, but can still continue activity. So when I needle somebody, I'll still say, hey, go to the gym, do whatever you need to do. If they're a competitive athlete, then we'll trial needling prior to their competition or sporting event and see how they tolerate it. Some people, again, love getting it the day of. Some people 2 days before. It just depends on their body response. So what happens after? The goal is to reduce pain, inactivate trigger points, and restore function. So this involves alterations in length and tension of muscle fibers, so loosening the muscles up, so to speak. This is shown as well, increased blood flow and oxygenation to the muscle. So if you increase blood flow to the muscle, you have more oxygenated tissue going there, and opioid release. This is to aid in daily functioning, activity, sports. This is an adjunctive treatment. So as I mentioned before, it isn't physio specifically, but it's one of the skills that we possess. So it's not the main form of physiotherapy, it's just another tool. You should always be given education, self-management, and home exercises. I thought I'd include that because that's all we talk about, and that's what physio is to us. And there's some research here. So I wanted to show some research, some relevant research, which shows the first one, effectiveness of dry needling for myofascial trigger points associated with neck and shoulder pain. A systematic review and meta-analysis, meaning a composition of quite a few studies. So it shows it's effective when compared to sham needling, so needling done not the right way, or in a control group, control being not getting any type of treatment. So that's improvements in the short and medium term. And the second interesting fact is physiotherapy more effective in medium and long term. So you could indicate from this study that, hey, it might be good to manage initially with needling and then move on to more physio, or do everything all at once, obviously. That's an interesting study. The next one, it shows another systematic review in which it indicates dry needling when compared to control or sham treatment provides a statistically significant effect on functional outcomes. And then no difference in functional outcomes exists when compared to other physical therapy treatments. Those treatments were self-management techniques, exercise, manual therapy, and a few other things. So yeah, I mean, we need more research to investigate the effects of dry needling in comparison to and in conjunction with other interventions, right? So I'm going to put this back on me now, and I'm going to adjust the screen on Zoom here. So back to me, back to me and Rob. So that point, I mean, is that these studies, they have to isolate things. So they don't look at everything all at once. They want to see a control group, sham needle group, physio group, and like actually getting needled. So what would be my implication from that research is, yes, it shows improvements, but no, it's not the standalone treatment. So it needs to be combined with physiotherapy directly. So I think this is where sometimes people can get maybe confused and say, hey, I just need the needles. I feel good. There's immediate benefit, which is shown through research, but long-term, there might not be a huge benefit. You might be able to manage with it, and it just comes like it's a recurring issue. And I think it's important to actually solve the issue. So get the needles for sure. I get them. Rob's done it on me a few times. There's a video way back on our Instagram post that show an immediate improvement in neck range of motion. But you also have the other stuff that takes a bit of time, like exercise and stretching, but harder for compliance just because you have to do it every day, all day, versus needling, you just get it done and then you're kind of feel like you're good to go, right? So anything to say about that, Rob?
No, that all sounded perfect. Yeah, exactly. It needs to be part of kind of a multimodal approach, right? Like you said,
Yeah.
progressive exercise at the same time and all that good stuff.
Yeah, I think it's very important to do that, because if you're not focusing on it from multiple angles, then you're not going to have treating the cause of the issue, right? So needling kind of treats the effect of the issue, but not the cause itself. So if it's a tight hamstring or whatever you want to call it, muscle, and you needle it, yes, you're treating the symptom, you're treating what's going on, but you're not figuring out, okay, well, is it a weak hamstring? Is it overutilize an exercise? Like, what is actually causing that muscle to fire as much as it is? So I think that's important to know. So I mean, I like to think I'm functional, so I'll do functional needling. So I'll needle somebody. Let's say if a squat is an issue, getting depth, then I'll needle and then test, and then needle, retest, and see how it goes. Or needle, and then the next day get someone to email me and say, hey, like, what did you notice? Did you notice a difference in improvement? So definitely having like the problem list listed out, right? So here's your problems, and here's how we're gonna target the problem. Yeah. Anything else to mention, Rob?
No, that's perfect. And I think like often you can sort of tie in a home exercise even to that test retest that you're doing.
Yeah.
So yeah, so I mean, if you're a squat's a perfect example where you could use a squat as your test retest and then prescribe like a squat like exercise as your home program, and
Yeah.
people can see the connection there. And I think it helps with buy-in when that connection is apparent like that.
Exactly. Yeah, I think that's a good point. Yeah, and buy-in is so important. Yeah, if you give people things at home to manage in between, then they're more inclined to continue doing that, and then continue for treatment as well. So yeah, needling for me with people, I just tell individuals, I'm like, I'll do it, a few times, and if there's no changes, then we're not going to do it again. Or if it's like a long-term management program, then that has to be discussed. Like, let's say if it's a motor vehicle accident patient, known to have more treatment than other injuries due to the complex nature of that type of injury. So what I usually tell people that have a motor vehicle accident and you might switch into like a management program is I'll tell them that I'm like, this is helping treat the symptom, but not the cause. It's just helping us manage the pain. And if they understand that it's managing for the time being, then it's a little bit better for treatment and it's technically the right thing versus like just doing it every week and not saying anything about it. I find then you think like you have to have it, but that's not the case. Yeah, because it's a course that we take as physios that just adds another tool to our extensive tool belt, right? So yeah, I use it to manage pain and improve function relatively quickly, and then to feed it with exercise and movement patterns to prevent it from coming back. And then if it does come back, the pain, is it less than it was before? Yes. Okay, then yes, we're getting the cause, and then maybe do some more needling with that area and then kind of move on from there. If Rob was here, I was going to show, we could have needled each other and showed what it feels like or what it looks like. I do have a video as well, actually, that I can do another screen share here. It's a muscle twitch. So you can see that, Rob?
Sure can.
Okay, if you see it, then everyone else can. So I'm going to flip this over. If we were both here in person, then we could have just shown you this directly, but social distancing. We don't want to be doing too much of this. So if you look at gentlemen
and cleaning, you want to have your lat engage with those movements.
So if we actually rewind, so if you look at this bottom area here, so right in there, you can actually see it twitch. There we go. See that? Did you miss it? There it is. Did you see that, Rob? He says yes. Okay, so that's the twitch. So when we're needling somebody, that's what we're looking for or trying to feel, right? So a lot of times,
maybe that would have been.
A lot of times, we can't see it, but we can definitely feel the trigger, right? So if we're palpating, one hand's on the patient and the other hand's needling, then we can palpate directly of, okay, there's the trigger, that's what we want, and then move on to the next point. Anything to say about that, Rob?
No, that's perfect. I think especially for those like larger, more superficial muscles like the lats, like you'll really you'll feel it. The person being needled will feel it as well.
Yeah.
Find sometimes for like say you're doing like a multifidi muscle in the lumbar spine.
Yeah.
Like they're like inches down.
Yeah.
So I find ones they can be harder to kind of feel that. So then I think it's important to check in with the person being needled.
Yeah.
And like, did you feel that kind of that deep ache or that twitch kind of feeling?
Exactly. Yeah. Yeah. There's lots of some of the smaller ones that are very difficult to palpate, especially with the face and TMJ. That's where I do quite a bit of needling. Find quite a few benefits with that. So Yeah, that's a good point to mention. I know the quads and like calf, like gastroc, those are crazy responses. Those are actually like the fun ones when you see them. You're kind of like waiting in anticipation, kind of scared, and be like, boom, there's the spasm. And then before I forget, I want to show everyone, this is, we can't needle each other right now, but I could show you something, I don't know, kind of cool. To me, it's cool. It's our needling cart. Our cart of fun right here. I can, right here, so everyone can see it. So we got like our stanhexidine, our cleaning solution. So with needling, we still clean the surface of the skin before we start. So you have these little cotton swabs that we have here, and then we dab it and clean the skin. And then each needle, so if you look at, let's say these needles here, there's different sizes of needles for different points. So when you look at the needles, they're all individually wrapped. So they're all sterile. So technically they're single-use needles. You just use them and then you put them in the sharps container and kind of move on. So with dry needling, you can use the same needle for the same muscle, but usually when I move on to another muscle or go to the other side, then I'll grab a new needle and just practice safe contact precautions, right? So that's a needling cart. This is actually a salon cart that I got from the salon, the hair salon I go to. And these actually work out perfectly because these like cutouts are perfect for these tubes and vials and stuff like that. So, and then we got Q-tips and things like that to clean up the blood afterwards if there is any blood. That's the cool part. This is like better than even needling somebody. This cart gets me excited when I see it. It's sleek. It's got like 2-inch rims on it. It's not too bad. And we obviously put on gloves during the needling process. Yeah, that's a few things about dry needling. Yeah, so people think it's all like for athletes and things like that specifically, but no, I'll do it with anybody that has those issues. The only time I avoid it is if the pain's severe, like if it's like an 8, 9 out of 10, or if there was a surgery done within like 3 months. I wouldn't put a needle in that area. Yeah, or if they had sensation issues, then again, or a fear of needles, that would be another contraindication. If someone had a phobia of needles, you wouldn't want to dry needle somebody. And IMS is a very, IMS just means intramuscular stimulation. So I would say dry needling, IMS pretty much mean the same thing, but it depends on what kind of course you take, right? Like Gun IMS is one that everyone hears about. And that one's completed by Dr. Gunn. So he explains the needling experience as more central. So targeting like spinal columns and nerves and things like that. So a different explanation, a quite heavy course. So it's quite a bit of knowledge you gain from that course. I did a biomedical dry needling course that was luckily offered in Edmonton. They go all over the States and Canada. So I got to do that course. Or for the physios that are watching, or new graduates or students, you can do the course relatively quickly when you're licensed. I would recommend just determine why you're going to take the course. If it's to benefit patients or you think it would be a good adjunct, then go for it. And I would also make sure it's an adjunct treatment. It's not going to like make you a super physio. Because even me treating initially in the first, 8 months before I did any needling courses, like I was still pretty effective. I feel like I was still treating lots of individuals and still getting really good benefits with patients. So I think these courses are great, but they're not always, you don't have to do them. So that's the big thing that I would say with that. Anything to add on to that, Mr. Robert?
No, I think that's like really important. I think when you come out of school and your coworkers are doing acupuncture, IMS, like manips, like your instructors in school, like they are giving you the best tools, the most important tools.
Yeah.
Yeah. So keep that in mind. There's lots of other like sexy interventions that you'll pick up along the way, but
Yeah.
But it all comes back to the fundamentals. And I think it's you can forget that sometimes, but you shouldn't.
You had to go back to basics, and that's what I did, and that's honestly what was my direction with building this clinic, pursuit of motion. it was to get back to basics. And I mean, like I'm sitting in a large gym right now, other than a nice view, it's very functional. So a lot of the skills, like I don't think you need certain courses specifically. I think it beefs up what you, like your base, right? Your stable base, like we think about the scapula or the low back. And then you kind of add all these other tools to strengthen that base. So yeah, I mean, I'll open up the floor to questions. Today's theory is a bit quicker because we're not doing any activity specifically. So if anybody on Zoom or on Instagram have questions, please type them out and let us know. Or I can unmute people and just call them out, which I won't do. Or I could actually, I have the power here. It could be anything about needling an injury. So far, we got no questions. Oh, here we go. And I think you do this too, Rob. I've seen clinics that add tens to the needles. Any thoughts on that? What would you say about that?
It's not something that I've like done a lot actually, so I can't speak much from experience on that one.
Yeah.
But yeah.
I know there's electroacupuncture, so essentially it's like the same process as tens. It's just little like jumper cables you put on the needles. I don't do it too often, to be honest. I know the effects, like it could increase the opioid effect with the pain gate cycle. It's shown to improve that as well, to close the gate, so to speak, and then stimulates the entire length of that muscle. So if you're doing, like if you're doing tennis elbow, for instance, you can put multiple needles along the trajectory of the muscle, and then you can stimulate the whole muscle, depending on the intensity in which you have the settings. So I've seen it done, and actually, just to show you, Brandon does it. So I'd say it's more like electroacupuncture. So dry needling, for instance, everyone thinks you have to piston, but you don't. You could do static needles and just put needles in different areas of the muscle and just leave them there. And if you do that, yes, you could target the whole muscle or more muscle, like the belly itself, by using tens. It's a very basic tens unit, just with different ends on them, different leads. So here's the unit. So you have this, and then you have these cables that get put in. So these little jumper cable things are what we put onto the needles themselves. So then you could stimulate the whole muscle. Again, I learned how to do it. I don't even know why I don't do it. I just think I can get the same effect without using it, so I can save a little bit of time. But again, that doesn't mean there's other ways to get to that end goal. So I think they're great. Like we have the unit here. This is Brandon's, but yeah, if it was somebody that had just the one muscle, then yeah, I do use it occasionally, but not too often. Hopefully that answers that. I got another question on Instagram here. What kind of wording do you use with your patients to drive home the point that it is an adjunctive therapy and exercise is still important? So the words that I would use is I would just tell patients exactly that. So I just say, we have all these tools to treat you. Our main bread and butter is your movement pattern, what you do at home. So I'll say, hey, the needles I can do here, you can't do those at home. So we're going to focus more on what you can do at home. So the needles, again, I'll do. There's no way to teach somebody how to do that at home. I'll say, like, here's your injury. Like, your muscle's very tight. The stretches and what you do for activity are going to eventually lengthen that muscle out, but the needles will help expedite that process or make it a bit more comfortable, right? So I can release a bit of that muscle right away, and then you superimpose these stretches at home to increase that length of the muscle. That's kind of how I would go about it. Initially, I do with like heavy education with patients for the first time about what physiotherapy is, about those 3 tenets that we talked about, and then kind of go from there, and they already know, okay, it's not the needles, it's not the tens that's making me better, it's me that's making me better. Like a patient yourself, not the physio, but you're doing all these things to benefit yourself. That's kind of how I would, lots of words there, but yeah, I would just say, What the patient has control over directly is the most important thing, versus everything else is passive. So doing needles, getting heat, ice, things like that. Yes, they're important, they have their place, but I think what you can control as a patient yourself is going to be the most important thing. Anything to add on that, Rob?
No, I think you said it perfectly. I think it's important to emphasize that that those things are what's going to kind of get them better, and that everything else is kind of just to support them along that journey.
Exactly.
And for sure. I think it's a point we've kind of beat to death, but it's worth beating to death.
I think so. It's initially when I heard it, I was like, oh, okay, that's kind of important. And now with this stage of the game, I guess you could say I definitely stick to those core tenets, because it's simple, right? You treat everyone with the same philosophy or similar philosophy, and if you can get benefits, then stick with it. Then you're doing the best you can. So I'm a firm believer in, you can do a lot of things to make yourself better. Yes, certain conditions, that's not the case. Like if you're looking at pain management, that's a little bit different. But I think to some extent, you can always benefit your patients with whatever skills you have. Any recommendations on needling courses for new grads? I would say, to be honest, like in my opinion, and this is good because it's not bashing any courses, I think you do whatever you like, any course that you like. I'm maybe a little bit biased towards the one I took, which is like the SMART seminars through the biomedical dry needling course. Then there's also the Kineticore. I think you did that, right, Rob?
I did, yeah, the Kineticore one.
So Kineticore as well. So I'd say either one, just make sure it fits your budget. Like I did the SMART seminar one because it was hosted in Edmonton back to back. And so that made it a little bit cheaper, versus Kineticore when I was doing it was, one was in Vegas and one was in Seattle. Would have been great trips, but I just didn't want to spend that much money to, like, personally, like I just didn't want to spend that much dough, because Vegas, I'd rather have a good time rather than limping around after getting needled. So I personally think either course is fine. I know I compared notes with colleagues that did the Kineticore course, and it was very similar how we were taught, because each instructor might teach it a little bit differently. So you might get a bit of bias from them. So I thought there was one point, the levator scapula, that was slightly different, and that's it. All the other ones were pretty similar. What about you, Rob? Any recommendations?
Yeah, no, like again, probably some bias. I did the Kineticore courses, and I found they were really good. They were really like rooted in like anatomy, which I thought was fantastic.
Yeah.
Yeah, but like you said, they're all over the place. I did one of my courses in Colorado, but it was like a lot of fun though. No regrets.
Yeah, it's pretty cool.
Like, it cost more though.
I think traveling would have been fun for sure. With courses. I know. Sorry,
I know for new grads, like some of the courses require, or this used to be the case, like a number of years of experience first. I think the gun course is that way.
The gun, I believe it's like 5 years, or you have to have levels 1, 2, and 3 orthopedic done. I don't know if that's the case still. That was a while ago. I know one of my mentors, he's not listening right now, Vince. If you're here, Vince, I love you. He did gun IMS, and it was quite a bit more detail. It was a pretty intense course. I think it's great. It's one that I initially wanted to do, but at that time I was like, well, I want to get certified, learn the needling approach, and then go from there, right? Learn, like they do a lot of chronic pain spinal segments, and that's how they treat. The technique itself, like pistoning and stuff, is very similar. It's just the philosophy or the education's a bit different. Like gun IMS is a pretty long course. So like my course that I did was really cool because it was in Edmonton. So most practitioners were from Edmonton. So I ran into a lot of colleagues and friends and stuff like that. So it was a good time. And the instructor, Scott Gallant, was awesome. And he even said, if all you're doing is dry needling a patient, then you got it wrong. Like you need to do you're a physio at the end of the day. So he drove home the point of like, it's not a main form of treatment, but it can be adjunctive or helpful. So yeah, to answer that question is whatever course like you like to, if you want convenience, then you can try to pick courses that are a little bit closer. Yeah, like I think it's either course is fine. If you're practicing needling correctly, then it doesn't really matter what course, I think. Yeah, because I've been needled by people with all the courses, and it's done correctly. It always feels appropriate, always feels good after. Like for me, I've been needled by Rob and Brandon, actually. Yeah, Brandon did a different course. I forget the name of his, but that was through an acupuncturist. And again, the results were the same. They both targeted the right tissue, and one was for the neck. Rob did my neck. Brandon did my low back and my hip once. And the results were great both ways in those two different courses, but similar techniques. So I think if you have your own personal philosophy correct, then I don't think it really matters what course you take.
I would make sure, like, for if you are taking a course, just make sure that the your provincial college recognizes it as a course that allows you to be certified. Like I know BC, they just kind of like retooled their stuff this year, and they have quite a short list of recognized courses.
Yeah.
So I know a lot of courses, even ones we've mentioned, you have to make sure they're recognized in your province.
Oh, hopefully the Smart Seminar one is still. Any more questions, guys? So on Instagram, if you're clients or patients that have had dry needling before IMS, if you have any questions about it, or if there's any more questions on Zoom, great questions. Naya might have a question or two. If you guest experience, or sorry, guest little person. Nice, she's getting big. She's getting big. Any questions, guys, on Instagram?
Focus.
Oh, is it effective for sciatic? Oh, I missed one. Apologies. How does it compare to acupuncture, and is it effective for sciatica nerve pain? So I think, okay, so compared to acupuncture, so acupuncture, same needles that you use, but in a different way. So acupuncture is based on an Eastern practice. So you have the meridians of the body, you have energy flow. So what you're doing with acupuncture is trying to normalize that flow, whether you're trying to increase energy in a certain point or decrease. That's that kind of philosophy through science. The research shows that, and for me, I need things supported by science, personally and professionally. It shows that when you put the needle into an area, it does have release with the muscle, and then it also does have more local blood flow. So you can think of a needle going in that causes inflammation, so it's going to increase blood flow to the area. So a lot of it is based on the meridians and energy flow, like it was created initially, versus dry needling, a little bit more scientific. I think they just took like an ultrasound and saw what happened with activating trigger points and then measuring the response afterwards. So dry needling is using the pistoning technique, going in and out of muscle tissue, versus acupuncture stays in for 10, 15, 20 minutes, the needles do. Yeah, so I'd say it's a bit different in terms of how it's conducted. And also with the meridians, with acupuncture, you have predetermined points that you have. So if I was doing needling on a patient for acupuncture, I can label them. I could say GV3 or GV4 or bladder 23. That way, if someone else does the treatment, they're going to do the same points. Versus dry needling, I just indicate which muscle and where in that muscle it is. So it's not exact, versus acupuncture is a bit more like has a map that you follow. That's a nightmare to learn because it doesn't make anatomical sense sometimes. And then sciatic nerve pain, I'd say, yeah, like if it is nerve pain, you could stimulate more blood flow to the area and help with that. If the sciatic is coming from like the glute muscles, if you release those muscles, you should see a quick response. And that's through stretching and like I would activate trigger points myself with my hands or elbow, do some stretching, and if that helps the sciatic pain, then yes, do some needles and do some trigger point release in the glutes. That could help quite a bit. Anything to add on that for sciatica, Rob?
No, I think that was good. Like you said, blood flow effects, and then if the sciatica is tied to a tight muscle or a faulty movement pattern, that's another to be well addressed by IMS.
Yes, I would agree. Hello, 3SB. What's up? Love your guys' live feeds. I'm sorry, Rob. Rob's on here as well, so that's why I'm talking to my computer, because he's on Zoom. Yeah, I think it depends, right? And then gun IMS, for example, would explain it a little bit differently and talk about central sensitization and things like that. So if you had like a radiculopathy in the back, like you have a pinched nerve, so to speak, you could needle that segment and stimulate that area. So you could help with numbness in the foot, for example, by stimulating the nerve at its root. I've done that before, and it's quite spectacular when it works. And I know the gun IMS approach goes into heavy detail with that when they educate their practitioner. So yeah, I think you can treat pretty much anything with needling. It just depends like why you're doing it, what effect you want. So if sciatica is from muscle, for instance, then yes, I would say needling is very effective, and I've had very good success with that. These are good questions. These are great questions. Anybody that questions about their injury and getting needled and like their experience or anything like that? Any questions at all? We'll give it a few more minutes. Or any question for anything? For Rob or I? What we like to do with free time, doesn't matter. So with that, I think tomorrow we have SI joint, the sacroiliac joint, I believe. Rob, you might be here in person for that. So we'll talk about that. It's a good topic. And strength and stability of that region, I think, is an important topic with that. So that leads into tomorrow. Any questions, Brooke, Anju, Sunny? Actually, wait, that's me. Well, this is a good question for sure. Does dry needling help with mental health and or anxiety? So I think acupuncture, for example, there are certain points that you could utilize to help with depression and anxiety. A few points being like in the hands and in the face. So we as physios can't treat that directly. So if you go to an acupuncturist, for instance, then an acupuncturist, for instance, you can get treatment for that, for depression, anxiety, that kind of stuff more directly. So they learn the needling techniques a little bit differently. So they spend 4 years being educated in acupuncture specifically, whereas we go a different route. We do quite a few years on anatomy, physiology, and things like that. So I think dry needling, for example, I mean, from what I've learned, no, it wouldn't treat anxiety and depression directly. But if your anxiety stems from your injury and if your pain gets better with dry needling, then sure, yeah, anxiety is going to go down. Like me, for example, with my shoulder, I was pretty anxious and miserable and scared, to be honest, that any movement I make was going to hurt so bad. And then getting needled helped with the pain. Therefore, yeah, sure, it brought down my anxiety because the pain went down. But I don't think it's direct with dry needling. And if Rob has something to say, he can say anything.
No, I think I think you hit the nail on the head.
Well, that's good. Imagine if I was, way off. Hopefully that answers that question. Yeah, that's a great question. I think, yeah, acupuncturist could help with that. Yeah, or even just a mental health expert like a counselor or psychologist would probably be the best, and they recommend acupuncture too, or have recommended it. So I think that's a way to go. And then any other questions? We'll give it a few more minutes. We still got I think 5 more minutes before the hour happens and kicks us out of Instagram Live. I do have a Google Drive set up too with all of our videos. I think there's 15 gigabytes total. So I'll kind of circulate videos. So it is up to date. So it will show all of our videos up to date, and you can click on the wrist. You can click on this. You can kind of do whatever you like. So that resource is there. So you could just send the clinic or me a direct message or an email, and I can share that with you. I don't have a problem doing that. Excuse me. And then they're all saved on my computer. So then one day we'll do a huge library and be able to have it all as a resource. That way these videos are great for now and then for the future too. So for now it's great because it gives everyone a chance to ask questions about their rehabilitation and get some tips. And then for the future, it helps with patients or clients that come in and, you know, want to learn a little bit more before they even see a physio. Yeah. We'll give it one more minute for any questions and then we'll sign out. Again, I thought that was going to be a lot quicker, but I think that's relevant information and research and very good questions. So I guess the main take home points for me would be that this isn't the main form of physio. It's a tool that we carry as physios. And we do this to kind of beef up or bulk up treatments and not so much to make it centered around dry needling or needling techniques. So yeah, our main scope is the education, exercise, and self-management techniques. And does Rob have anything to add to that?
Nothing to add.
Nothing to add. Okay, good. Good thing we're so cohesive. Yeah, so thanks for everyone for asking questions and things like that. And we like feedback and it helps us to create more subject matter. So if anybody has any questions about specific injuries, let us know and we can make topics for next week. Like this is likely going to be going on for a little bit of time, and our mandate is to continue these every day, no matter how, you know, if people are annoyed of us or not. I hope not. And then let everyone know, let friends and family know if no one's got anything going on, like check us out. We like to just, you know, be physios, and this allows us a way to still reach a wide audience, right? We have physio students, we have physios, we have clients in the past, and anybody in the community, right? So let's keep it up. Thank you, Rob. Thanks for everyone on Zoom. Thanks for everyone on Instagram, and we'll see you tomorrow. Maybe I'll have a hat on like Rob has right now. It's a nice hat.
Hey, thanks.
I wonder where it's from. Oh my gosh, wow, that's the trendy. We have hats, everyone. So if you want a hat, I could drop it off at your like front door or something like that. I'll do deliveries. We can't drop off food, but we can drop off hats. Yeah, so other than that, thanks guys. Peace out. We'll see you tomorrow.